Well, I think it reinforces what I've long believed, which is that we inherited a broken NHS on its knees, and that's why it's so important that we pick up the challenge, including the challenge that you've shown visibility on today in this reporting, and rebuild the NHS, get it back on its feet. That's what we've already started on with some important first steps. We said we'd get 2 million extra NHS appointments, get those waiting lists down. We said we'd do it the first year of a Labour government. We've done it in the first 7 months, so I'm really pleased about that. Last week, I abolished NHS England. That was jobs in communications, in policy and strategy, because I want those jobs on the front line measured in doctors and nurses, and so that will help to contribute to the further hole that you've identified in the capacity. But we will do this with the staff and take them forward on this journey of rebuilding with us, working with the staff, not doing it to the staff.
Channel 4 had to battle for 10 months to get these nurse fill rate numbers which after the Mid-Staffordshire scandal, the then Health Secretary Jeremy Hunt thought was so important for public confidence that he committed to publishing them. 6 years ago, the Tories stopped publishing them. You could do it overnight. Will you consider publishing them?
Well, I'll look at all options here. There's no options off the table. But what I'm focused on is making sure that we get those waiting lists down.
One thing that would increase frontline nursing numbers would be bigger salaries. Can nurses expect pay rise?
Well, obviously last year we settled the dispute. There'd been strikes. So instead of nurses and doctors on the picket line, we had them on the front line, and that's made a huge difference. We did have a pay settlement last year, which I think most in the NHS thought was
fair.
And
is there going to be another one this year?
Well, there's a process that we're in the middle of going through at the moment, so I wanted to get ahead of that. But I was pleased that we're able to put in place a good pay settlement, a well-deserved pay settlement for our doctors and our nurses and our NHS staff last year.